We should take responsibility for our own health. We shouldn't rely on anyone or anything. We shouldn't rely on our health practitioner who works for us, and we should be partners. We should be able to communicate. We shouldn't rely on an insurance company or politicians or certainly the government. The government, I mean, it takes them so long to have meetings about, we want to change the I mean, look how long it took them to change the recommendations about cholesterol and saturated fat, decades. And finally they made it and nobody even knows it. But the vitamin D is a good example too, because I'm trying to think when I started writing about vitamin D, it was probably in the early 80s. And I lectured somewhere, I want to say 1982, a big sports conference. And I was talking about the importance of vitamin D supplements. And a number of people raised their hands and said, these are practitioners. Why would we want to give anybody a vitamin D supplement? There's danger in overdosing. If they just walk to their mailbox, they get enough vitamin D. Well, not if they carry an umbrella or have sunscreen. And the cosmetic industry, which is where the sunscreen chemicals all come from, has done such a good job in keeping people out of the sun. That has contributed so much to the low levels of vitamin D and the high levels of skin cancer.
Yeah, once again, it goes back to context. And, like I was saying about the whole context in terms of what leads to cardiovascular disease and how that LDL is contextual. It's the same thing. I kind of connected those dots with the whole skin cancer scare, because our skin is made to absorb vitamin D. And you look at the whole evolutionary process, people who live closer to the equator have darker skin. As you move out, you have people with lighter skin because those couple months you have good sunlight, you got to get in as much as you can. And it's interesting because that whole thing evolved with Ansel Keys and the diet heart hypothesis. And then, so you're taking away the essential ingredients and replacing them with sugar. And so the skin cells are not going to be very healthy. They're going to be more prone to them. They get sun. These unhealthy skin cells are getting, nuked with sun, all the wavelengths of the light, but they don't have the elements to either process the sunlight nor protect themselves from the sunlight.
Right. It's especially a problem in people as they get older.
Yep.
In particular, but it's in everybody who has excess body fat. Your skin cannot process the sunlight and convert it to vitamin D very well, if at all, in some of them. So,
well, yeah, and those skin cells are obligated to burn glucose over beta oxidation, right? And beta oxidation is a much more complex thing that nobody talks about, because it's not just about burning fat; it's about converting all those other elements in cholesterol into those essential fatty acids that line your cells and build the mitochondria and create the hormones. And it's that big, amazing process.
Yeah. In other words, we need cholesterol.
Yes. And we need to have the metabolic ability to metabolize it, because if you got too much glucose, too much fructose, too much alcohol cutting to the front of the metabolic line, well, the cholesterol doesn't get metabolized. It accumulates, and there you go.